Hi, this is Annie, and this is my research grand rounds. I'll be presenting a case study in Hashimoto's. So this client case is a 34-year-old woman diagnosed with Hashimoto's after her second childbirth. She is taking synthetic thyroid medication. It is showing improvement. Her chief complaints are weight gain, fatigue, hair loss, thinning, dry skin, and sensitivity to cold, all which are common symptoms for hypothyroidism. Her labs are showing low thyroid levels and presence of thyroid antibodies. And although she is showing improvement from the medication, she prefers not to stay on medication if she doesn't have to. So the question I come up with is, can vitamin D supplementation improve the thyroid autoantibodies and thyroid levels in Hashimoto's thyroiditis? A little bit about Hashimoto's. It is a common cause of hypothyroidism and is actually an autoimmune disorder, not a thyroid disorder. And the clinical findings will show a production of thyroid antibodies. And what happens is that there's a malfunction where the body starts attacking the thyroid, and it results in an underproduction of hormones and a slowing down of the metabolic processes. And treatment usually involves the medication levothyroxine. Levothyroxine is a thyroid hormone, and what happens, it's a synthetic form of T4, which is metabolized into T3. So you get both T4 and T3 as a result of this medication. So epidemiological studies show there's actually a relationship between thyroid autoimmune disorders and vitamin D deficiency. In particular, this is especially shown in premenopausal women. It's also shown that there is an inverse correlation between TSH levels and vitamin D. And women in particular, they are shown to have lower vitamin D status, and Hashimoto's is actually more common in women than in men. And in between men and women who have Hashimoto's, women often show higher autoantibodies. So vitamin D, as we know, has a lot of different roles. So in relation to Hashimoto's, why it is thought to help with Hashimoto's as an autoimmune disorder is that vitamin D is an immunomodulator via the VDR receptor, via the vitamin D receptor, the VDR. So this is also strengthened because there's a correlation between people who have a SNP in the VDR or the CYP27B1 gene and several autoimmune diseases. Vitamin D also has a very nice effect on monocytes and dendritic cells because it's able to inhibit inflammatory cytokines, TNF-alpha, interleukin 1, 6, 8, and 12. And it also suppresses T-cell proliferation, which is a kind of lymphocyte that plays an important role in the immune response. So for my PICO, my search terms, I plugged in Hashimoto's, vitamin D, thyroid levels, and thyroid antibodies. And I came up with this study. It actually, my whole PICO was in the title of the study: Can supplementation with vitamin D modify thyroid autoantibodies and thyroid profile in Hashimoto's thyroiditis? This was a double-blind randomized clinical trial. It was actually started in 2016. And it was published in 2018. So it was a double-blinded randomized control trial, and the aim was to investigate what if vitamin D had an effect on the thyroid profile and the autoantibodies in females with Hashimoto's. So for the inclusion criteria, 42 women were enrolled. They were ages between 18 and 48 with Hashimoto's, which this client is in this age range, and their autoantibodies were at equal to or greater than 38, and they are on medication levothyroxine. And the exclusion criteria: any disease that affected the immune system, like type 1 diabetes, multiple sclerosis, IBD, or any other autoimmune diseases, if they had any kind of liver malfunction with their enzymes, if they were malnourished, if the BMI was less than 18 or greater than 40, if they were going through menopause, pregnancy, or lactating, and also if they were already supplementing with vitamin D, A, or omega-3 within the last 3 months. So the study had 2 arms. It was the vitamin D group that received 50,000 IUs of vitamin D3 every week, and the placebo received placebo pearl, which was an edible paraffin oil, once a week. And they both went on for 3 months, and their dietary assessment in both groups was also assessed, just to monitor the vitamin D intake. And they did that by having a 1-day dietary recall and 2-day records. So as far as these methods, the 42 women were enrolled, but actually only 40 completed the study because 2 withdrew due to using corticosteroids. And as you can see here, there was no significant difference between age, BMI, levothyroxine medication, and also the serum level of vitamin D between both groups at baseline. There was also no significant difference in their energy intake and their macronutrient intake, except for the vitamin D intake. Obviously, that was after the supplementation between the 2 groups. So, comparing both groups before supplementation, their mean levels of TSH, T3, T4, and T3, and also their vitamin D levels, they were all pretty similar before supplementation between both groups. And I'd like to also add that throughout the study, there were no significant adverse effects or complications. And out of the 40 women who actually enrolled and completed the study, there was 100% compliance. So in the vitamin D group, we can see that they started off with levels which, according to the Endocrine Society, would be deficient or insufficient, actually, around 25 plus or minus 11, and they ended up with almost double in their levels, and this was significant. And also the calcium levels in the vitamin D group. The calcium levels in the vitamin D group, there was a significant increase that was shown. And the thyroid antibodies, thyroglobulin antibodies, also showed a significant difference, as well as the TSH showed a significant difference. There was a decrease in the TSH and the thyroglobulin antibodies compared to baseline. However, there was no significant difference in the TSH and the thyroglobulin antibodies between both groups here. See, the difference is not significant here, although it was significant in the vitamin D group compared to baseline. Also in the vitamin D group, the anti-TPO antibodies, they decrease compared to the placebo, but it was non-significant. However, the researchers thought that may be because the study was only 3 months. They had a feeling that if the study lasted for 6 months, that this would be different. This may have shown a significant decrease. Vitamin D did not affect T4 and T3 levels. However, in the placebo group, the T4 decreased significantly compared to the baseline, just in the placebo group. So this study, some of the limitations, it had a relatively short follow-up period, 3 months. It's basically a standard follow-up, and it's not long enough to actually make a firm conclusion. Also because, according to the researchers, this was the very first study that evaluated vitamin D and thyroid status. In addition, it was a relatively small sample size of just 40 women, and the small sample size might explain the reason for the null effect of the vitamin D supplementation on the other factors. And because of that, I graded this study B minus for this particular client case. I thought that it was very helpful in some ways because A, it was a woman, and these were all women, and B, they were on levothyroxine, and C, because she was within the age group, but because it was a short follow-up and a small sample size, and it was a very first trial evaluating vitamin D and thyroid function, it wouldn't be like, I wouldn't have given it an A. So as far as my recommendations, I would definitely assess the vitamin D status, and I think that's a good thing to do in people with autoimmune diseases, including hypothyroidism, Hashimoto's, because it is an autoimmune disease. And although the Endocrine Society recommends 30 and above, I'd like the vitamin D levels to be in the optimal range of between 50 and 80. So if it was below 50, I would supplement as needed as an add-on therapy. And if we go back to the here, the vitamin D levels here, in the vitamin D group, the levels of vitamin D actually did go up to 50 and above, 50 and 64, 65, up above here. So, and that's after 3 months of time, and that was able to lower their thyroid antibodies. So if the study went on for 6 months, we might even see more promising results. So as I was saying, I would assess the vitamin D status and include that as an add-on therapy with a gluten-free diet, because there is a lot of literature showing the positive outcomes for gluten-free diet in Hashimoto's. And then I would reassess the labs and symptoms actually every 3 months. So after the first 3 months, if things are looking good following this study, I would continue for another 3 months and see how it looks in 6 months. And these are my references. This is the one that I used for the study, and this is just a supporting one. Thank you.